In addressing dual diagnosis clients that need intervention, one has to look at the diseases of psychological or psychiatric illness and the issue of addiction or chemical dependency or drug abuse. Much like the pain and addiction patient, prior to the intervention, once you get a full history from the individual and see if the illness of chemical dependency or the illness or the psychological illness or psychiatric illness predates the other. The concept of self-medicating comes into play in dual diagnosis. Many individuals when growing up have psychological problems. Examples include attention deficit disorder, panic disorder, anxiety disorder, trauma disorder, and post-traumatic stress from issues that occur in childhood or adolescence. Untreated psychological scars that occur during that time may lead the individual to start medicating themselves for these symptoms. This may start with drinking, smoking pot, and escalate quickly into a variety of other drugs that camouflage or treat the psychological uncomfortable symptoms that are occurring during that period of time. As a result, clients go on to self-medicate their psychiatric illness and over time cannot stop the drugs because the underlying psychiatric illness is so profound and uncomfortable that it is past their ability to tolerate or cope with, and so they continue to take drugs. Many of these people are on prescription drugs as well as street drugs. In addressing an intervention on a dual diagnosis patient, one has to address the psychological underpinnings and the ongoing psychological condition if one is to be successful. Much like a pain and addiction, once that's addressed in an appropriate fashion during the intervention and a client is referred to a facility where the psychiatric component can be taken care of, the outcome is much better. One would not want to take somebody who's in extreme psychological pain, take them off drugs and leave them so uncomfortable that their psychological and or physical symptoms are intolerable. Always remember that people reach intolerable pain, and both physical and psychological, and if it is intolerable to them, the inevitable result is to return to a drug addictive or drug use pattern.